When it comes to diabetes, there are different types of diabetes, and I want to explain to you in this video what those different types of diabetes are and what causes them. Hi, my name is Charmaine, and I'm a registered dietitian that helps people reverse type 2 diabetes with plant-based eating. So what does diabetes mean? Diabetes is a disease of carbohydrate intolerance, meaning that your body isn't able to process carbohydrates. Now, carbohydrates is a main source of energy for us. That's why diabetes, if untreated, can be debilitating and dangerous. What generally happens in diabetes is that insulin isn't working its function. Insulin is the hormone that regulates your blood sugar and helps you bring glucose from your blood into the cells so that your cells can use it for energy or to store it for energy later. So if your body is not making insulin, or if your cells are resisting to insulin's action, then that is what causes high blood sugar levels. Diabetes come in three main types: type 1 diabetes, type 2 diabetes, and gestational diabetes, and there are more variants that you may want to know about. Make sure you watch till the end to learn all about them. So let's talk about type 1 diabetes first. Type 1 diabetes usually happens in childhood or young adulthood. In some cases, it also happens beyond young adulthood, and it usually is called latent autoimmune diabetes of adults. So with type 1 diabetes, it means that your body isn't able to produce insulin. Now, this is usually caused by an autoimmune response of your body that attacks insulin-producing cells, which in this case, white blood cells thinks that pancreatic cells that are responsible for producing insulin are the enemy, and they destroy the pancreatic cells. And that is what causes type 1 diabetes, because you won't be able to produce insulin. In this case, everyone who have type 1 diabetes needs exogenous insulin, meaning insulin from outside sources to help them sustain their life. Now, when it comes to type 2 diabetes, this is not caused because your body can't produce insulin. This is caused because your cells in your body are resistant to insulin, which is called insulin resistance. This used to be called adult onset diabetes, but nowadays we are seeing more and more children have type 2 diabetes, so it's not really a fitting name for it anymore. And this is the most common type, as 9 out of 10 people who have diabetes have type 2 diabetes. And because the body is resistant to insulin, your body produces more and more insulin to compensate and to try to make things work, to try to balance your blood sugar. And if that is left untreated, it can cause your pancreatic cells to exhaust. And eventually, some people who have type 2 diabetes for a long time, who don't really reverse insulin resistance, may have beta cells that are already exhausted and can't produce insulin anymore and have to rely on exogenous insulin, just like someone who has type 1 diabetes. Traditionally, diabetic drugs are used to counteract this problem. Some drugs make you more sensitive to insulin. Other drugs makes your body produce more insulin to counteract this problem. Or some makes your liver produce less glucose to send to your bloodstream, and that also helps with lowering blood sugar levels. Now, traditionally, most people will limit starch or sugar when it comes to type 2 diabetes. However, this can be a symptom-focused approach, because the idea is if you eat less carbs, it's going to spike your blood sugar less. However, you're not really fixing the problem of insulin resistance, and new research show that changing your diet can improve your insulin sensitivity and allow your cells to be sensitive to insulin again. If you want to learn more on how I help people reverse type 2 diabetes and help their cells become insulin sensitive again, go to my free training. Link is in my bio to learn more about this. Let's talk about gestational diabetes. Gestational diabetes is very similar to type 2 diabetes. So usually it is caused by insulin resistance, but gestational diabetes happens when a woman is pregnant and her blood sugar level is elevated. Now, Hormones and insulin resistance can cause your blood sugar to go higher than normal levels, and it can affect the fetus or the baby. So that is why a lot of doctors take gestational diabetes especially serious, because it doesn't just affect one person, it affects two people. While gestational diabetes usually disappears after birth, it usually means that your body is insulin resistant, and you do want to focus on reversing insulin resistance to prevent you from getting type 2 diabetes later down the line. Because a lot of women who have gestational diabetes when they're pregnant, they usually get diabetes after they give birth, or even sometimes the diabetes don't go away. So with gestational diabetes and type 2 diabetes, the solution is similar. You want to be able to reverse insulin resistance in order to either reverse type 2 diabetes or to prevent type 2 diabetes. Now, there is another type of diabetes that is not often talked about, and this is called maturity onset of diabetes of the young, short for MODY, M-O-D-Y. Now, this is caused by a genetic characteristic of the body that can cause pancreas to produce less insulin, and it is a dominant gene. The person is very likely to have high blood sugar even if they're not overweight or don't have cells that are insulin resistant. Since sometimes insulin may still be produced by the body, just inefficient, one may or may not need exogenous insulin, depending on what your doctor thinks. And the treatment of this is also similar to type 2 diabetes, where sometimes you'll be given diabetic drugs to normalize the blood sugar. Now let's talk about pre-diabetes. Pre-diabetes is where your blood sugar is higher than normal levels, but not as high to be diagnosed with type 2 diabetes. When you have pre-diabetes, it usually means that you're on the road to have type 2 diabetes if you don't change anything about it. And this is a big indicator of insulin resistance. And insulin resistance usually even develops 10 to 15 years before you're ever diagnosed with prediabetes or diabetes. But the good news is, if you want to reverse prediabetes, type 2 diabetes, you'll be able to do so by changing your lifestyle and your diet. If you want to learn more on how I've helped hundreds of people reverse type 2 diabetes with plant-based eating and get off diabetic medications, then go to my free training. Link is in my description, and I'll see you guys there.